just like Justine, right? She's here. Now, this brings up another point. So let's say that we do this test, and so her 90-90 test is negative, correct? But let's say that for her, if you remember back to the first day of pathology, we have that picture of the baseball thrower, and he has excessive external rotation. If she's a gymnast, if she's a hurdler, she's going to need more than normal hamstring length, okay? So the 90-90 test, you take her there and you go, oh, well, she's normal. She's normal for normal individuals. She's not normal for what she needs it to do. So for that test, it doesn't necessarily fit for her. So then I am going to, now, if we did this, right, and she stops here, then I'm not going to take her into flexion to do the knee extension, okay? Because, again, the hamstring with Kelsey, because she was about here to start at 90, then I take her here so that she's even tighter when I try to extend the knee, because I'm taking her slack up proximally. If you have somebody who's super tight here, if I take up the slack here, this is it. Then you're going to be like awkward down here trying to straighten their knee out, right? So, you know, you have to think about what you're asking the person to do, okay? And so I want to put their knee in a position to where it's, you know, I always joke, it's all about me. Okay, if you have to do this 10 hours a day, you better be using appropriate body mechanics. Otherwise, you're the one who's going to be laying on the table and somebody's going to be working on you. Okay, so it is about getting the appropriate mechanics. Now, when you do the other point that I didn't bring up, so piriformis stretch, right? Relax. So it is a combination of flexion, adduction, external rotation. Okay, some of you, when you're doing the stretch, your person's feeling pinching in the anterior. So what does that tell you? They're not clear for that much flexion. That associated joints of the seal, they were not clear. But because we're just going through the stretch, or you go, oh, and the person's got their knee all the way to their opposite shoulder, and you go, oh, they're not really feeling anything. Yeah, because they're not tight. Okay? You only do this stretch if you have muscular infield, limited range, right? Otherwise, you're not doing it. So, you know, when you do that, you go, okay, the benefit of this is I feel what loose feels like. Now, when you go, oh, wow, this person's super tight, okay? Now, the other thing is that if, for Justine, let's say that when we flexed her, and let's say that she got to like 105 on her flexion, and she gets an anterior pinching, so she's not clear to get her hip to 105. But at 100, she doesn't have symptoms. So I'm going to have to do the stretch and not flex her to 105. Okay? So in this position, if I add the flexion component last, she will have the least amount of flexion range available to her. Okay? So just to show. So this is her flexion. That's her in-range flexion in neutral. Then if we take and externally rotate her, that's her flexion. If we externally rotate adduct her, that's her flexion. Okay? So the component that you add last will have the least amount of range available to it. So if you know, right, because again, I'm going to have to clear her joint to do this stretch. So if I come up, and when I come here and feel her internal, she goes, oh, I get this pinching here. But then on a Fair's test, she also has a positive. Now you're faced with something. She's tight back here, but if I do the motion, sorry, external, let's say we do external, and she feels symptom, okay? And then I say, gosh, I need that as part of my stretch because she is tight posteriorly, so I'm going to have to play with the order to get it right. Okay? The last thing that I would say is, you know, it's kind of when we talked about doing hip flexion and where we force our axis to be, my center, if I'm doing flexion and my center ends up here on Justine, then she's going to flex her low back. Okay? It doesn't matter what I try to do because my center is now here on her. This is where the motion is going to happen. So the same thing, if I do this, and I shift my center over here, this hip is going to be off the table. because my center's all the way at her opposite hip. Okay? So if you watch, you know, when I do this, my center stays over the joint that I'm treating. Okay? If I shift this way, she's going to rotate. If I shift this way, she's going to flex her low back. So you look and say, okay, I'm treating right here, so my center needs to stay over that joint. If not, it doesn't matter, whatever compensation you try, other than shifting your center, they will not change, because you're forcing them to move in that direction. Okay?